South African cancer patients, activists together with health workers are set to take to the streets of Johannesburg demanding the Department of Health to spend 784 million rands set aside by Gauteng Treasury in March 2023 to outsource radiation oncology services for over 3,000 patients who are currently on the backlog list. The cancer crisis in Gauteng is driven by severe shortages of both operational radiation oncology equipment and staff within the public sector. This is particularly evident at Steve Biko Academic Hospital and Charlotte Maseke Johannesburg Academic Hospital, experiencing the most critical shortages. According to Cancer Alliance and Section 27, there have been patients waiting for radiation oncology services for over 2 years now, with some who have had repeated reoccurrences of their cancers as a result of not obtaining radiation oncology services. And to unpack this, I'm joined by Head of Health Rights at Section 27, Kanyisa Mapipa. Good morning. Glad to have you join me.
Good morning. It's good to be here. Thank you for having us.
All right. Just explain to us the state of things regarding the lack of cancer machines in Gauteng and how this is affecting cancer patients in the region.
Yes, so the problem with radiation oncology really did start with a shortage in machinery and a shortage in staffing at both Charlotte Maxeke and Steve Biko. Charlotte Maxeke more so than Steve Biko Hospital. These are the two primary centers that deal with radiation oncology in the province. And Charlotte Maxeke, as it stands, only has, from our last encounter with the hospital, only has about 2 radiation oncology machines. We are aware that the department was in the process of procuring some more machines for the hospital, but whether this has been done, we simply do not know. What we do know, however, is that the patients are still waiting for these services and are not getting these services in the time that their treatment allows. So, for instance, with an average patient, for example, who has breast cancer, you're required to get the treatment within 3 months of you having surgery of the to remove the tumor. But now these patients are having to wait 2 and 3 years. And in that time, they get the reoccurrences of the cancer time and time again because they're not getting this very fundamental service at the end of their treatment, which will see them not getting the cancer coming back again in at least say 10 years.
But what were the reasons given for these shortages we have for cancer patients? Was any reason given as to why there is shortage?
So not really. So the shortage is a result of issues to do with machines and issues to do with staffing. We know that with the machines, the issues are lack of maintenance of the machines, not replacing the machines in time or ordering new machines in time to replace the machines as they need to be decommissioned. We know that with staffing, the issue has been a lack of competitiveness with the private sector as well, with the other provinces in the country in terms of what is paid to staff. So what we're seeing is that a lot of the staff is moving from Gauteng to other provinces, public sector hospitals in other provinces, because of the difference in the payment of those very individuals. So if on a grander scale, I would say that the issue has been one where the Department of Health in Gauteng has just not focused a lot or has not done what it needs to do in order to ensure that it keeps the personnel in the province and does not lose them to the private sector or other public sector hospitals in other provinces in the country. And it also hasn't done enough to make sure that the machinery are kept up to date, are kept maintained, are kept replaced when they do need to be decommissioned.
I mean, quite a number of issues you have touched on. You talked about shortage in workforce and also payments to these workforce. How about the patients themselves? Could you share with us the challenges these cancer patients are facing due to lack of resources and also support in Gauteng?
Yeah, so the patients, we've had the pleasure of working with a number of the patients who are on the backlog list. And in fact, this plight was brought to us by them, patients who had been on the backlog list and have suffered reoccurrences. And, some of them are quite brave in order, to speak out against this injustice, to speak out so that they can save their lives. A lot of them, are mothers with children that they're very terrified to leave behind. They have families that they're also very terrified to leave behind. We have one such case with a lady who had breast cancer, and because she had been waiting for over 2 years for her services, her and her husband decided that it would be better off to sell off some of their material possessions and also to get into a loan agreement with their bank so that they could be able to afford treatment in the public sector. The treatment cost about 153,000 Rand, and not everybody who is reliant on public healthcare can afford that kind of money or even has access to those kind of loan facilities. And yet this is what the government is forcing people to do. They're forcing people to go into loan agreements. They're forcing people to sell off their possessions over equipment, over services that are constitutionally theirs. They're constitutionally guaranteed these services, and yet they cannot receive them, and they have to live in constant fear of leaving their children very young, of dying, and not being able to see their children grow. And so this is the constant anxiety that we see with these patients. This is why they came to us. This is why they've come to get assistance from us. So the situation with the patients is rather dire, and there's been no communication from the Department of Health regarding how this money is going to be used, or whether there is any progress on the procurement of the outsourcing of radiation oncology. Initially, our agreement with the department was that these services would be outsourced to the private sector, and this was designed so that at least the public sector would the pressure on the public sector would decrease somewhat. And
Kanisa, I'm afraid that's the most we can take on the news for this section of the news. Thank you so much for bringing light to this issue, and hopefully things are resolved as soon as possible. Thank you so much, Kanisa Mapipa, Head Health Rights at Section 27. Thank you once again.
Thank you.